So how many patients do you have, David?
So here at Sydney Children's Hospital, we see about 120 new patients each year newly diagnosed with cancer. And the majority or the largest percentage, about 25%, have leukemia. The next is brain tumours, and then we see a whole range of other tumours, including kidney tumours, neuroblastoma, bone tumours. And what's really important is that with so many different tumour types, we need to learn as much as possible about each individual child's individual tumour and the best way to treat individual children. And a lot of our research is now focusing on understanding how each child's individual tumour is made up, and actually being able to take their tumour, look at it under the microscope, do specific genetic testing, even do drug testing on each child's tumour, and then develop specific treatments that may benefit that particular child. And that's a hugely expensive endeavour, but we think it's the way of the future, so that we're not treating everyone, one size fits all, but individualising the treatment and getting better outcomes on an individual basis. Rewarding than seeing a child go through all this cancer treatment and be cured at the end of the day. And for my first few years, that's what inspired me. But actually, as time went on, I realised it was the kids who don't make it. They're the ones who are making me get out of bed every day, not just to help treat them, but actually to inspire a research program to actually help us work harder on the research side to improve the outcome for these kids and kids who would follow in their footsteps. And that continues to be what inspires me to this day. It's actually some of the worst tumours are the ones that I'm working on in my research, because they're the ones where we need the most investment, we need the most research. We're seeing the most devastating stories, the most tragic cases. And even if we can make just a little bit of difference, even if we can find a treatment that just might give a little bit of hope, that is going to make a huge difference for these kids. And ultimately, if we can increase the cure rate by 1%, that's one child in 100 that we've saved. And if we can do that every year, year by year, then we'll end up saving hundreds, if not thousands, of lives. And that's what keeps me and the rest of the team going.